Attitude plays an incredibly important part in treatment and success of cancer treatments. And it is not hard to imagine the word cancer is such a scary word that it can cause people to get very depressed, down low, and it can affect our ability or our resources that we marshal to fight the cancer. So it's very important that patients know that there is light at the end of the tunnel, which is the analogy I often use with them and say you're going to go through some rough weeks or months or years depending on what the case may be, but there is hope. There is hope that at the end of that time you will have a better life, better quality, and more time, in some cases cures depending on the condition. Each person is so unique. Each one of us are. Some are totally in control, wanting to know everything, every little aspect of it, and we certainly want to cater to them. Other patients who rather not know, who want you to be the driver and lead them through it. Some patients have tremendously strong social support, have a lot of family members to help them through. Some are by themselves. Some patients have a tremendous desire to do things for an XYZ goal that they have to achieve, and others are not as motivated. Another very important concept is the enormity of the whole thing. Sometimes you cannot have the entire discussion in one session or one visit. You have to break it in pieces. Like anything else big, I say one day at a time. Right now, this is the immediate game plan. And then when they are back in a few weeks, we talk the next game plan so that they have time to absorb, to synthesize, to adjust to it in a way. And I think that makes a big difference. The family support is great, and if they have it, that's tremendous. So we definitely want to marshal all the resources. Like for some patients, the grandkids are their life, and sometimes that's something that gives them inspiration to fight when they may otherwise not do that. For some others, there may be a motivation of taking a trip that they've always thought about, and they're not ready to do it now, but they want to do it down the road and want to be better for it. For some patients, it is just talking to their priest or their rabbi or their whoever their faith person is. Sometimes it could be a person who's gone through the experience. So we are big believers in community cancer support groups. In fact, at our facility, we support 2 active groups, which are tremendous. I mean, we're all in it together. Then, of course, the comfort and the strength that they get from just feeling part of our Florida Cancer Specialist community, I think that is tremendous. And that's always been one of the focuses, is to make the patients feel welcome, make them feel part of our big family, as I call them, and open to questions, so have that level of trust develop over time so we can be a resource for them. Assessment of their mental status or mental health, emotional health is very important, and we do that at every visit. And we are very blessed to have some wonderful counselors in the area who can help. So I think all of those things, and of course there are the cases that we may need medications to help them if they have issues with major depression or difficulty coping. But mental health as a component in overall success of cancer cannot be underestimated. Tremendously important.